Hello friends, I am Dr. Sajjan Rajpurohit. I am a cancer specialist at Rajiv Gandhi Cancer Institute, Nitibag, South Delhi. Today I will be talking about a cancer which affects our senior citizens. It's a cancer of men beyond the age of 50 to 60 years where they will almost many times ignore it as if it's a part of the normal lifestyle or of aging. So what happens with this cancer to begin with is that the symptoms are quite similar to a kind of prostatic hypertrophy or benign prostatic hypertrophy. So I'm going to talk about carcinoma prostate. Prostate is an organ which is a male sex organ. It helps in generating a fluid which is a composition of the semen, and it also helps in protecting the urine from getting infected. But with advanced age, there's an increase in the size of the prostate, and sometimes a growing prostate can turn cancerous. So carcinoma prostate would usually manifest as symptoms which are quite similar to BPH, which is benign prostatic hypertrophy. So these symptoms will be frequency of urination, urgency of urination, difficulty during the urine passage or pain during the passage of urine, nocturia or increasing urination during night. The person has to get up 3 to 4 times to go for urine. Apart from this, there can be blood in the urine, there can be constipation, or there can be pain during defecation. These are the earlier signs. However, at later stages, there can be lower backache, there can be weight loss, and in advanced cases, there can also be involvement of other organs like liver or lungs, which can lead to symptoms like jaundice, cough, breathlessness. So what is important is to differentiate this from the beginning from a very common condition which almost like 1/3 of the men suffer beyond the age of 60 years, which is BPH. You have to consult your urologist. So it is sometimes confused with a very common disease, or I would say it's not even disease, it's like a physiological change in the body which is in the form of benign prostatic hypertrophy. And it is very important for your doctor as well as you to be aware that these symptoms can be overlapping with this symptom or with this disease. So the medicines for BPH should not be started just upon basis of the symptoms. The patient should undergo at least a good quality ultrasound, a serum PSA level, and if the PSA levels are high or the prostate on ultrasound appears suspicious for cancer, it should be followed up with an MR imaging or a magnetic resonance imaging, MRI of the lower abdomen or the pelvis. And depending upon that, sometimes if the suspicion is really high or the PSA levels or the prostatic specific antigen levels are high, the patient should undergo a biopsy of the prostate, which is done transrectally. And once the diagnosis is established, we stage the disease. The staging of disease will depend upon whether it is only confined to the prostate or it is going beyond the prostate. Most common site of other organ involvement is the lower back or your backbone. So the good thing about CA prostate is that more than 80% of these cancers are actually low grade and they grow over many years. So there is no need to immediately panic, and if it is organ confined, then it can be treated and cured with either surgery or directed radiation. We have got robotic surgery as well as high resolution as well as very conformal radiation techniques available with us, which can help us treat the local forms of prostate cancer. And many of these people will be cured of the disease. Even in advanced cases, nowadays with the advances in oncology, the disease can be very well controlled for many years, and patients can be absolutely asymptomatic, living their healthy and normal lives the way they were living before getting this disease. So there's a need to be aware of this entity because it's one of the common cancers in men, and if we are alert, if your physician is alert, they will definitely rule this out before they consider the more common entity, which is benign prostatic hypertrophy, as your diagnosis. So this was what I wanted to tell you about carcinoma prostate. There's nothing to fear about cancer. Many more advances are happening on everyday basis in cancer management, and the future really looks promising to me. If you need any other further information on carcinoma prostate, or if you know somebody who needs help, you can contact me on my email, which is Sajjan Rajpurohit@yahoo.com, or you can connect with me at the rate of Sajjan80 on Twitter, or you can contact me through Lybrate. If you want to meet me personally, then I am sitting at Rajiv Gandhi Cancer Institute, Nitibag, daily from Monday to Saturday, and you can take appointments through the net as well as through our friend desk. Thanks a lot.